Very much. So it seems like everybody these days either has a MySpace, a Facebook, or a Twitter page or something like that. So I guess it only seems natural that the medical community is catching up. We've got a local doctor here who is here to talk about tweeting in the operating room. Dr. Vip Dev, thanks so much for being with us.
Thank you very much for having me.
So I guess the question is, a lot of people might be wondering, why would you start doing that?
You know, it's primarily it's an educational purpose. It serves to bring really the operating room to the general public, and that's what we want to do. To get what we do to the general public, give them equal access, and educate them about their potential operation or their loved one's operation. What we're hoping to do is create a big library of procedures.
Okay, so who do you think this is going to be benefiting? Is it the patients? Is it you know, perhaps future doctors?
It's going to benefit both. Patients, it's going to benefit them by them getting a little bit more information about the procedure, getting to see it, and I think that'll alleviate some of the nervousness that they have.
Okay.
And then potential or future doctors and doctors in training and doctors that are out that are in other parts of the world that don't necessarily get a chance to see how we do it here in this country, because we're kind of like the standard a lot of the times. That if we can get this to them, that better helps them treat their patients.
Yeah, kind of setting the bar.
That's exactly right. And we want to raise the bar of information and medical care.
So how exactly is it going to work? Because a lot of people might have some concerns about safety.
Sure, absolutely. First of all, it's all done in a certified operating room in the hospital setting. So everything's on the up and up. It's very safe. We have a nurse that's specially dedicated to tweeting. And I will be saying the procedure out loud as I do it. And
she will actually be typing it into the computer?
She will be typing it. Yeah, I won't tweet and then go back and run to the OR and do it, because that's 100% unsafe. So as I say it out loud, the nurse will be tweeting the message. And the nice thing about Twitter is it is 140 characters of just a simple sentence or a line, and that's it. Brief. You don't have to go and read a lot about it. Just a very brief synopsis of that particular part of the procedure.
So is that something that you normally do in the operating room? Do you kind of talk out loud and talk about what you're doing?
Well, you know, my operating rooms are a bit unusual. I do have students that come in, I have nurses that come in training and so on. So what we try to do is I try to let people in on the little logistics of what's going on. And it's a very relaxed, carefree atmosphere, so they can learn and really soak it all up. And now what I want to do is bring that to the general public, within reason, of course, because we have to abide by certain laws. And so we want to make sure that we don't mitigate any safety issues, but we want to bring this information to the public.
Do you think this is something that'll help you out, kind of talking out loud, making you, you know, maybe rethink what you're doing, making sure that you're making the right moves?
Absolutely. I think you're absolutely right. It does make me think out loud, but in all honesty, it doesn't make me rethink what I'm doing. You know, before the operation starts, I have a goal. And the goal is set. And it's one of those things, it's decision and execution.
Well,
and that happens every single time.
Confidence, because you want that in a doctor.
You don't want to change halfway, because that means you have changed your operative plan. And that doesn't happen often. So you want to make sure, especially in plastic surgery, you want to make sure that you have your decision made up, the procedure planned, and it's all about execution.
How quickly is this all going to start?
We're starting this Thursday, actually. We've been doing it for a while, but we're going to start this Thursday. This Thursday will be the first case that will be live, and then we will, every Tuesday and Thursday, be compiling a massive library of procedures from head to toe.
That's awesome.
Cosmetic and reconstructive.
Okay, so if people are interested in finding you on Twitter, how can they find you?
Twitter, the username is VIPMD.
Okay, VIPMD. Easy enough. Dr. Vip Dev, thank you so much for being with us.
You bet, it's a pleasure.
John, back to you.